Hello, I'm Professor Dr. Syed Arshad Husain. I'm a consultant pulmonologist in Dubai. I'm also a professor in pulmonary medicine adjunct at Gulf Medical University in UAE. A lot of people do ask me this question that if I'm snoring, do I have obstructive sleep apnea? Is snoring the same as sleep apnea or not? So let me clarify this point that snoring could run in the families and it could be a physiological thing. It does not attach to something significant. But sometimes when people are snoring loudly, they do have a problem, and the problem is have what we call sleep apnea problem. So what happens is they have a stoppage of breathing in the middle of the night. So they have dips in their oxygen level at night time, and these dips cause their sleep cycle to break into many fragments. So normally it's non-rapid eye movement stage 1, 2 and 3. 3 is slightly more deeper sleep. Then we go into REM sleep, the rapid eye movement sleep, which is very deep sleep. So this happens 6 to 7 times in the night, and this is very important to have that at night sleep. But people who have sleep apnea or dips in the oxygen in the brain do not have this circuit completed properly. So that leads to them waking up in the morning feeling unrefreshed. They slept, but they're not refreshed. They want to go back to the sleep. The whole day is tiring for them, lethargic they feel in themselves, and also they are sleepy in the daytime. They could doze off and sleep in odd corners if they get the chance, because their sleep is not being fulfilled by their nighttime lying in the bed. So this is very important to identify that person has sleep apnea. Why? Because it has attached cardiovascular mortality related. So people can have heart attacks, people can have strokes, people can have blood pressure problem. The blood pressure would not be treated unless the sleep apnea is diagnosed and treated. So these things are very important. Equally, they could have accidents and trauma on the roads. So sleep apnea hence is a very important modality to diagnose, and the way we diagnose is through a proper study, gold standard study called polysomnographic sleep study. Once we've done this study and we have come to the conclusion where somebody has a mild, moderate or severe obstructive sleep apnea. Now if it's mild, we treat it in a different way, but if it's moderate or severe obstructive sleep apnea based on the dips of oxygen at night, we then give them a treatment which is called CPAP. So that's continuous positive airway pressure that's given at night time, and they have to wear a mask or nasal mask to take this flow of air. So CPAP is basically air with pressure that goes to this either the mouth or the nose and causes this narrow gap between the palate and the tongue to open up, so the snoring completely disappears. So this is the advantage of CPAP treatment. The snoring vanishes, snoring improves. Also their oxygen to the brain also improves when we start the CPAP. And so it starts to give them better quality of sleep at night. When they're getting better sleep at night, they become more fresh in the daytime. Their concentration spans improve. They're able to achieve more targets. They're more full of energy, full of beans. The success rate of this machine is 80%. So there is no comparative success to the CPAP success on these patients with moderate to severe sleep apnea. The problem lies is when we start the patients on this kind of mask or a device attached to it called the CPAP, this is air going with pressure, and they feel claustrophobic, they feel frightened, they're not used to it. So the first 1 or 2 weeks is very difficult, and I tell my patient to just persevere with the CPAP. So do 1 hour, 2 hours, whatever time they can tolerate, and then increase the number of hours. Ideally, they should use it about 6 to 7 hours at night to get good results out of the CPAP. When somebody is on CPAP, they need to work on weight reduction strategy, because that helps very well. They can reduce the severity of the sleep apnea can be reduced if they are able to lose weight. I ask them to lie on their left lateral, right lateral position to prevent the tongue coming close to the palate. And the same way that I ask them to not to have any beverages in the night time, because that also can break the sleep circuit. All these strategies do help immensely, but weight reduction can be achieved better after the sleep apnea has been diagnosed and treated, and it is vitally important to lose weight. So that is the thing I wanted to say about the sleep apnea problems. Thank you.